Perfect Balance Healthcare presents Lick, Stick, and More with your host, Dr. Nandita Koodie. Join me to explore the minds of thought leaders as they share golden nuggets on the impact of faith integration in practice, professional development tips, and innovative solutions to bring you beyond ordinary healthcare. Hey y'all, welcome in for another episode with me, your host, Dr. Nandita Koodie. Today, I'm sharing a solution that I wish I had handy from the beginning of my career. When I first started with Perfect Balance Healthcare, I was running cash-based patient services. And one of the solutions that I had was a cost savings program where I would help patients find where they can get their medications at the best value and it'd be convenient for them and how I can make it convenient for them. So I was looking into patient assistance programs. And I was looking into, okay, what are some of the different programs that different pharmacies are running? Free antibiotics programs or generic discounted programs for cash pay, whether it be 30-day or 90-day or whatever the value was, and being able to connect patients with these resources. That was the part that for me was the most fulfilling, was helping them find the best value for their medications and not being biased to any one pharmacy that I was actually working at or affiliated with. And so I became well-versed in the different community programs that were accessible to patients that they may not have known about. Another thing I would do is kind of look into if they were on brand medications, if they were eligible, putting them in contact with patient assistance programs from the manufacturers that were manufacturing the medications that they were taking to kind of help them out for at least the first year savings if I could, or whatever opportunity that they had. And so the way that I structured this, and if it's something you want to take into your own practice as you start your own consulting practice, was just 40% of that first fill savings I would receive because they were already getting it at a better value than what they were paying before anyway. So it was a win-win for both of us. And then they were able to continue saving thereafter. And so instead of it being like a drug discount card that I was giving out that may not be beneficial for the pharmacies, I was instead just connecting them with direct resources to pharmacies that were providing the best value for the medications that I could find. Also just looking for, substitutions and saying, okay, well, this is a therapeutically equivalent drug that this pharmacy has as a better value for you if you were to pay cash than even your copay. And so, that was something that was really beneficial for my patients. But what has been brought to my attention recently through the independent pharmacy that I was working at is a solution called needymeds.org. And I would love to share this tool with you because it has been instrumental in me being able to come up with the best market value or at least an idea as to what people are charging for medications. And this is a great tool. Even if you're working in the pharmacy and you're looking to see from an independent pharmacy standpoint, what you should be charging patients for meds based on what other pharmacies might be charging and how you can offer a better value. And they have accessible on their website, you can click into a tool that they have for comparing different costs between pharmacies per medication. So you just type in the name of the medication, the quantity of the drug that you're looking for, and the zip code, and you can do within a 1 mile, 5 mile, so on and so forth radius, and kind of get an idea as to what the market value is for some of these medications. So I found this particularly useful in the independent pharmacy setting where you may not know what your competitors are pricing medications at, and you may be really severely underselling medications below their market value. And so the tool isn't 100% accurate. I know our pharmacy was coming up as a lot less than what we were charging for fair price for medications. However, a pretty healthy estimate and a very useful tool with regard to coming up with cash-based pricing for patients who walk in and they need that. And so this was a great tool to compare to our drug acquisition costs to come up with a fair price for some of the collaborators that we have in the community. One application for this might be if you're looking to run an agreement with a free clinic and you have your own formulary. How do you set the prices for the medications that are on that formulary? And so needymeds.org was a tool that we used to be able to price out our formulary relationships with some of our community relations. And so one of the things I did was, just become really well-versed with what the different value opportunities were and what the different resources were. But here you have a website that collects all of these different resources for multiple states, for all of the states really, and put them all in one easy to find place. And so they have patient assistance programs that are funded by the drug manufacturers. They have disease state related opportunities. So I thought that that was really cool, that now we're not just looking at it from the manufacturer perspective, but we're looking at it from a patient condition perspective, which is really cool to find resources for that, as well as free clinics that might be existing in your area that you can go in and talk to about how you can support them as a pharmacy as well. Where are they getting the data from? How do they figure out who's charging what? Because obviously, our independent pharmacy was showing up on the list and we weren't giving out our information, to anyone who was coming knocking on the door asking for it. So what I was able to do was dig a little bit and find that they were actually getting some of their information from Argus Health, which I believe now has been rebranded by DST Pharmacy Solutions, or something to that nature. I'm not really big on healthcare politics or acquisitions, but that's just something that I was able to come across with regard to where they're getting their information. So I found this tool to be particularly useful for pricing, for cash pay patients, or for coming up with formulary decisions. But it would have been quite useful for me in the beginning as I was running my own cost benefit program, looking to help patients save. And so beyond just, working directly with the patients, this is a tool that you can take business to business as well as you're looking to develop different relationships. And so if you're interested in learning more about how you can start your own consulting practice supporting patients in your communities with programs such as this one, I'd be happy to help. Just reach out to me. You can email me at n.koodie@pbh.life or reach out to me on any of the social media outlets. I hope that you all are able to take this tool, whether it be for your own private consulting practice as you look to grow and support your community, or bring it back home to your independent pharmacy to apply it there to help with better pricing and getting the best value of medications out to patients. And so I wish you all happy holidays this season. I love you, I love you, I love you, and take care. God bless. Thank you for listening to this episode of Lipstick and More. Subscribe and follow us on YouTube and all the social media sites at Perfect Balance Healthcare, or visit us anytime at pbh.life.